Hi there, it's Dr. Mary Kaye here, and I want to welcome you again. This is a very sometimes taboo topic, but necessary topic, and I want you all to feel comfortable talking about it because suicide does remain the 10th leading cause of death in the United States. What does this mean? It means that it impacts everyone, you all, young and old, as well as middle age. It means that we are having different obstacles, different crises that are arising, whereas we feel hopeless and feel that there's no other way out but death. But I'm here to tell you today that that is not correct. There are many other options, and the first thing that I want you to consider is doing exactly what we're doing right now, having these intimate conversations and asking for help, making sure that we are recognizing the warning signs and symptoms. And we're going to discuss a few of those so that, again, you won't feel as though this is something that you're unfamiliar with. A lot of times when it comes to one thinking about ending their lives, there are things going on such as divorce, bullying at school. There are also things going on such as terminal illnesses. And again, individuals are thinking that there's no other way. However, remember that we do have support, caregivers. We have different organizations who are here for you and who want to hear your story. Again, you can also have therapists who will walk with you, therapists who will give you resources and actually talk to you about the pain that you are feeling. Some of the immediate signs and symptoms that we want to look for would be an individual changing their mood really rapidly. So someone who is normally very happy and smiling, and now you see them and they seem more melancholy or depressed. You also want to look for just the opposite. That individual who has been melancholy or depressed and now are very happy. The reason why I point that out is because they could have resolved that now this is what I'm going to do. The answer to all of my concerns will be taking or ending my life. All right? So ask the question. There's a myth that states, hey, if I ask about suicide, that's going to lead an individual to actually take that action. That couldn't be more wrong. One of the best things you can do is actually ask, because 9 times out of 10, that individual is looking or asking for help. They want to make sure that there's someone who acknowledges them, someone who feels their pain, someone who can comprehend and connect with what they may be going through. You just might be that person. You do not have to hold a mental health degree. All you have to do is have a heart and the love of God and care for that individual. Pick up on some of those signs and symptoms, hear what they are not saying, okay? I mentioned before about bullying. I really want to highlight what's going on with our children present day. When we see those individuals, as far as our youth are concerned, who are committing suicide, a lot of it has to deal with not being accepted by their peers, social identity. So be it they are struggling with their sexuality or how they identify. We want to be sure to support them and let them know that no topic is off the table. If they feel that they can't talk about the changes that are happening within their body or the unacceptance of peers, then again, they're going to isolate. They are going to do other things and take measures into their hands. Think about what's going on with social media right now. Our children can go on YouTube and look up almost anything. They're seeing videos that highlight suicide as an option. They're seeing documentaries that talk a lot about it. So we want to lead the discussion. We want to let them know that yes, it's real, but it does not have to be the option that they take. Hand in hand, we can wrap our arms around them, let them know that they are loved and that this too shall pass. We can let them know that they are unique and not an outlier. We can let them know that their differences is what makes them special. It doesn't mean that they have to check out, okay? And now speaking to our adults, those of you who have went through kind of our midlife crises, does it happen? Yes, it does. Maybe you're not where you want to be in this life present day, but remember, as long as you're living, there's time to achieve those goals. This is not going to be the end. We have choices, and again, there are people who will walk with you. So take these things into consideration that, again, divorce, changing jobs, being terminated, even COVID, you all, doesn't mean it has to be the end. There's a way to channel that pain. I hope that you've learned something today. And I also pray that you do seek help if you find that you are having any thoughts regarding struggling to live. I want to give you the number to the National Suicide Prevention Hotline. That number is 1-800-273-TALK. Feel free to call. This line is open 24/7, you all, for anyone who may be struggling. Together, we can get through this. Until next time.